This is my son, Quentin. He's a cool kid. He's just really cool. Quentin and his brother are a little bit competitive, but they get along really well. They've got each other's backs. Quentin is a fighter, for sure. At a very young age, he was diagnosed with neurofibromatosis type 1 and NF1-related plexiform neurofibromas, or PN, benign tumors that can grow along nerves anywhere in the body. NF1 is his diagnosis, but that does not define who he is as a person. At about 17 months, he developed a cluster of, at the time I didn't know, neurofibromas on his cheek. So I brought it up to his physician, and eventually she recommended an MRI, and it came back that he has neurofibromatosis NF1. He was diagnosed with PN at 22 months. With PN, even with debulking, the tumor can grow back. It would grow in 23% to 33% in volume every 3 to 6 months. Quentin's tumor got so large that I could put it in the palm of my hand. He's had 10 surgeries and countless complications. Sometimes we cry together and we have really hard conversations about where NF takes you, and things that he has to deal with. That is really hard. And you compartmentalize it. You become, at that point, you're a caregiver and not a parent. I mean, even now, he gets stares. One time somebody asked my older son if he punched him in the face. His brother is definitely his protector. Probably one of the best educators and advocates he could ever have. When Quentin was 5, our doctor told us about a new trial for a drug called selumetinib, which would later be called Koselugo. The doctors told us about possible side effects, including the most common ones, such as vomiting and stomach pain. They felt that Koselugo could potentially decrease the size of his tumors. He had to do the preliminary testing and all of that first, but we signed on. Quentin was one of 50 patients that were on the original trial. After FDA approval, whenever there were any questions along the way, we could utilize OneSource, which is a free personalized patient support program offered by Alexion. OneSource was amazing because as a parent, you're juggling so many things, and then you add that on top of it to know that there's an advocate for you and that a resource that you can go to, it's very nice to have. Koselugo has definitely been a good fit for Quentin. He just had an MRI a month ago, and he is stable. He takes Koselugo every 12 hours, so twice a day, and it is part of life. Quentin's side effects with Koselugo they've been pretty minimal. He did have some diarrhea. He did have some issues with acne. Of course, this has been Quentin's experience, and others may have a different experience with Koselugo.
Since taking Koselugo, I've noticed a big difference in my tumor growth. I feel like I can do everything else embryos can.
Quentin is in a good place now. Well, we still have doctor's appointments, but it's very secondary. It is a sense of relief that he's on Koselugo, that we can breathe a little. I love being a mom. It's one of the most rewarding things I think a person could ask for. I can't imagine not having them. And I'm so thankful for all Koselugo has done for him.
Indication and important safety information for Koselugo. Indication. What is Koselugo? Koselugo is a prescription medicine that is used to treat adults and children 1 year of age and older with neurofibromatosis type 1, NF1, who have plexiform neurofibromas that cause symptoms and cannot be completely removed by surgery. It is not known if Koselugo is safe and effective in children under 1 year of age. Important safety information. What are the possible side effects of Koselugo? Koselugo may cause serious side effects, including heart problems. Koselugo can lower the amount of blood pumped by your heart, which can be severe. Your healthcare provider will do tests before and during treatment to check how well your heart is working. Tell your healthcare provider right away if you get any of the following signs or symptoms: persistent coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Eye problems. Koselugo can cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment. Tell your healthcare provider right away if you get new or worsening vision changes, including blurred vision, loss of vision, dark spots in your vision, floaters, other changes to your vision. Stomach, intestine, and mouth gastrointestinal problems. Koselugo can cause diarrhea, vomiting, nausea, and mouth sores. Diarrhea can be severe with Koselugo. Tell your healthcare provider right away the first time that you get diarrhea during treatment. Your healthcare provider may give you medicine to help control your diarrhea and may tell you to drink more fluids. Skin problems. Koselugo can cause severe skin rashes. Tell your healthcare provider if you get any of the following signs of skin problems: rash that covers a large area of your body, flat skin rash, raised bumps on your skin bumps that look like acne, blisters, peeling skin, itchy rash, hair thinning or hair loss, alopecia. Increased level of an enzyme called creatine phosphokinase, CPK, in your blood, and muscle problems. Koselugo can cause severe muscle problems. Treatment with Koselugo may increase the level of an enzyme in your blood called creatine phosphokinase, CPK, which may be a sign of muscle damage. Increased level of CPK in the blood is common during treatment and can also be severe. Your healthcare provider should do a blood test to check your blood levels of CPK before you start taking Koselugo and during treatment. Tell your healthcare provider right away if you get any of the following signs or symptoms: muscle aches or pain, muscle spasms and weakness, dark reddish urine. Your healthcare provider may change your dose, temporarily stop, or permanently ask you to stop taking Koselugo if you have any of these side effects. Before taking Koselugo, tell your healthcare provider about all your medical conditions, including if you have heart problems, have eye problems, have liver problems. Females who are able to become pregnant. Your healthcare provider should check to see if you are pregnant before you begin treatment. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment. Males with female partners who are able to become pregnant. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Are breastfeeding or plan to breastfeed. It is not known if Koselugo passes into your breast milk. Do not breastfeed during treatment and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription, over-the-counter medicines, vitamins, or herbal supplements. Certain medicines may affect the way Koselugo works. Especially tell your healthcare provider if you are taking a supplement containing vitamin E, aspirin, blood thinners, or other medicines to treat blood clots. Koselugo capsules contain vitamin E, which may increase risk of bleeding. What should I avoid while taking Koselugo? Avoid St. John's wort, grapefruit or grapefruit juice, and Seville oranges during treatment. Most common side effects in children include vomiting, diarrhea, increased level of an enzyme called creatine phosphokinase, CPK, in your blood, dry skin, redness around the fingernails, nausea, skin bumps that look like acne, fever. Most common side effects in adults include rash, diarrhea, skin bumps that look like acne. These are not all the possible side effects of Koselugo. Call your healthcare provider for medical advice about side effects. You may report side effects to AstraZeneca at 1-800-236-9933 or at https://us-ae-reporting.astrazeneca.com or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see patient information and instructions for use in the full prescribing information for Koselugo, selumetinib, or at https://alexion.com/documents/Koselugo_USPI.pdf.